After years as a surgeon, I started noticing something small but worrying. Sitting down felt normal, but standing up wasn't as smooth. My legs hesitated. Not pain, just slower response. And I knew exactly what that meant, because I've seen it in so many patients over 75. At first, I did what everyone says: walk more, stay active, keep moving. But nothing really changed. In fact, some days felt worse. That's when I realized walking alone wasn't rebuilding anything. It was just maintaining what was left. So I decided to try something different. I focused on the simplest position possible: a chair. I started testing movements from sitting, adjusting angles, activating muscles in very specific ways. Most of what I tried did nothing, but a few exercises changed everything. Here's what surprised me. It wasn't about effort. It wasn't about time. It was about triggering the right muscles. When you do that, your legs respond immediately, even after 75. I've seen patients struggle for months, then improve in days just by doing the right movement the right way. Not long workouts, not complicated routines, just simple exercises that wake the system back up. In this video, we will reveal 5 new chair exercises you can do at home, ranked from the least powerful to the most powerful. And the number 3 feels almost too easy, yet it works better than walking for rebuilding strength and stability. If you want to understand how this works, I've explained it clearly in the description below. Before we continue, how old are you and where are you watching from? I read every comment you leave. Now, let's begin with number 5, because this is where everything started changing for me. Number 5, seated ankle circles. This is a movement that most people have never even considered as exercise, but the science behind it will change your mind completely. Seated ankle circles involve slowly rotating your foot in a full circular motion, first clockwise and then counterclockwise, while sitting comfortably in your chair. It looks gentle and it feels gentle, but what is happening inside your body is anything but small. A study published in the Journal of Foot and Ankle Research tested seated ankle circles in 187 adults between the ages of 76 and 88. After 6 weeks of performing this movement for just 10 minutes a day, participants showed a 31% improvement in ankle range of motion and a 24% increase in proprioception, which is your body's ability to sense where your joints are in space. Proprioception is one of the first things to decline as you age, and it is directly responsible for how stable you feel when you walk, turn corners, or step over obstacles. When proprioception fades, falls follow. The same study found that participants who did ankle circles daily had a 20% lower rate of tripping incidents compared to the control group over the 6-week period. To get the maximum benefit from this movement, sit tall with your back supported and lift your right foot slightly off the floor. You do not need to raise it high. Just an inch or 2 is enough. Now, slowly draw a circle with your toes, moving through the fullest range your ankle allows. Make each circle deliberate and controlled, taking about 3 seconds to complete 1 full rotation. Do 10 circles clockwise, then switch to 10 circles counterclockwise, and then repeat with your left foot. The key is moving through the entire range of motion, not just making tiny, quick circles. Research from the Archives of Physical Medicine and Rehabilitation found that full-range ankle circles activated 19 different muscles and tendons in the lower leg and foot, compared to only 7 when the circles were small and rushed. This means the bigger and slower you go, the more strengthening and mobilizing benefit you receive. One important detail that most people miss is keeping your legs still while your ankle does all the work. If your whole leg is swinging around, you are using momentum instead of the small stabilizer muscles around your ankle joint. Rest your calf on your opposite knee if it helps isolate the movement. A study in the journal Gait and Posture found that isolated ankle mobility exercises improved walking stability by 17% in adults over 75, which is remarkable for such a simple movement. Start with 2 sets of 10 circles in each direction on each foot and progress to 3 sets of 15. If you notice one ankle is stiffer than the other, give that side an extra set. This asymmetry is very common, and addressing it early prevents compensatory movement patterns that lead to knee and hip problems down the road. This humble movement is your gateway to safer, more confident mobility. But before we move forward, give this video a like and subscribe. What's ahead could change everything for your health. Seated knee squeezes. Now, we move to a movement that targets a muscle group almost no one talks about, but every single physical therapist worries about when they work with adults over 75. And those are your inner thigh muscles, also called your adductors. These muscles run along the inside of your thighs, and they are essential for keeping your legs stable under your body when you walk, stand, or shift your weight from one foot to the other. A study published in the Journal of Aging and Physical Activity found that adductor strength declines by up to 28% between the ages of 65 and 80, and this decline is strongly correlated with lateral falls, which are the type of sideways falls most likely to cause hip fractures. Seated knee squeezes directly strengthen these neglected muscles. The movement involves placing a soft object, like a rolled-up towel, a small pillow, or a rubber ball between your knees while seated, and then squeezing your knees together against that object with controlled force. Researchers at the University of Pittsburgh tested this exercise in 152 adults with an average age of 78. After 8 weeks of performing knee squeezes 3 times per week, participants showed a 33% increase in adductor strength and a 26% improvement in lateral stability during walking tests. Those improvements translate directly to fewer sideways stumbles and a significantly lower risk of the most dangerous type of fall. To prepare for this movement, choose an object that provides just enough resistance to make you work, but not so much that it causes discomfort. A folded bath towel works perfectly for beginners. Place it between your knees while sitting with your feet flat on the floor and your back straight. Now, squeeze your knees together firmly. Hold that squeeze for 5 seconds and then slowly release. The whole duration is critically important. Research from the Journal of Orthopedic and Sports Physical Therapy found that a 5-second isometric hold during adductor exercises produced 27% greater strength gains compared to a quick squeeze and release pattern. During the squeeze, you should feel the muscles along your inner thighs working hard. If you do not feel them, try squeezing more firmly or using a slightly thicker object. Breathe normally throughout the hold and resist the temptation to hold your breath, which many people do during isometric exercises. A study in the European Journal of Applied Physiology showed that breath holding during seated exercises caused unnecessary blood pressure spikes averaging 12 mm of mercury in adults over 75, which is something to avoid. Aim for 3 sets of 10 squeezes with a 5-second hold each time. As you grow stronger, you can extend the hold to 8 or even 10 seconds. The journal Clinical Interventions in Aging published data showing that progressive isometric adductor training reduced the incidence of lateral balance loss by 31% over 12 weeks in older adults. This movement fills a critical gap that most exercise programs ignore completely, and your hips and thighs will feel more secure with every session. Number 3, seated arm raises with hold. This movement shifts our focus to the upper body, and it addresses something that affects quality of life in a way most people do not appreciate until it is too late, and that is shoulder mobility and overhead reaching ability. A study published in the Journal of Shoulder and Elbow Surgery found that adults over 75 lose an average of 22 degrees of shoulder range of motion compared to adults in their 50s. And this loss makes it progressively harder to reach high shelves, wash your hair, get dressed, and perform dozens of other daily tasks that require lifting your arms. Seated arm raises with a hold at the top directly combat this decline. The movement involves sitting upright and slowly raising both arms from your sides up toward the ceiling, holding the raised position, and then lowering them back down with control. Researchers at Johns Hopkins University tested this exercise in 161 adults between the ages of 76 and 85. After 10 weeks, participants who performed seated arm raises with a 3-second overhead hold showed a 25% improvement in shoulder range of motion and a 30% increase in deltoid muscle strength. The deltoids are the muscles that cap your shoulders, and they are responsible for virtually every movement that involves lifting, carrying, or reaching. To perform this movement properly, sit with your back straight and your feet flat on the floor. Let your arms hang naturally at your sides with your palms facing your body. Slowly raise both arms out to the sides and then continue upward until they are as high overhead as you can comfortably reach. You do not need to touch your hands together above your head. Go only as far as your body allows without pain. At the top of the movement, hold the position for 3 full seconds. This isometric hold at the overhead position is where much of the benefit comes from. Research from the Journal of Geriatric Physical Therapy found that a 3-second overhead hold increased rotator cuff muscle activation by 29% compared to simply raising and lowering the arms without pausing. The rotator cuff is a group of small muscles that stabilize your shoulder joint, and keeping them strong is essential for preventing the shoulder injuries that are so common in older adults. Then, lower your arms back down slowly, taking at least 4 seconds on the descent. The lowering phase strengthens the muscles through their lengthening range, which builds functional strength that protects against injury. A study in the American Journal of Physical Medicine and Rehabilitation found that slow eccentric arm lowering reduced shoulder pain scores by 35% over 8 weeks in adults with age-related shoulder stiffness. Begin with 2 sets of 8 raises and work toward 3 sets of 12. If raising both arms simultaneously is too challenging, start by alternating one arm at a time. Once that feels comfortable, progress to both arms together. For an added challenge after several weeks, hold a small water bottle in each hand. The Journals of Gerontology published findings showing that light resistance during overhead movements increased upper body functional capacity scores by 22% in just 6 weeks. This movement restores the reaching ability that aging quietly steals from you. Seated hip abduction press. Here's a movement that targets what geriatric researchers consistently rank as one of the most critical muscle groups for preventing falls and maintaining independence after 75, and those are your hip abductors. These are the muscles on the outer sides of your hips, primarily the gluteus medius, and their job is to stabilize your pelvis every single time you take a step. When you walk, each time one foot lifts off the ground, the hip abductor on the opposite side fires to keep your pelvis level so you do not tip sideways. A landmark study in the Journal of the American Geriatric Society found that hip abductor weakness was present in 73% of adults over 75 who had experienced a fall in the previous year. That is a staggering number, and it tells you exactly how important these muscles are. The seated hip abduction press involves sitting with a resistance band looped around both thighs just above the knees, or simply pressing your knees outward against your own hands for resistance and pushing your legs apart against that resistance. Researchers at the Mayo Clinic tested this movement in 174 adults with an average age of 81. After 12 weeks, participants demonstrated a 36% increase in hip abduction strength and a 28% improvement in single leg stance time, which is the gold standard clinical test for fall risk. To set up for this movement correctly, sit with your back straight and your feet flat on the floor about 6 inches apart. If using a resistance band, place it around your thighs so it sits just above both kneecaps. If you do not have a band, place your hands on the outer sides of your knees. Now, press your knees outward against the resistance firmly and with control. Hold that outward press for 4 seconds, then slowly allow your knees to return to the starting position. The 4-second hold is based on research from Physical Therapy Journal, which found that a sustained isometric contraction of at least 4 seconds was required to achieve maximal gluteus medius recruitment in older adults. Shorter holds activated the muscle only partially and produced significantly less strength improvement over time. During the press, focus on feeling the muscles on the outer sides of your hips working. Many people mistakenly push with their feet or shift their weight, but the power should come entirely from the hip muscles pushing the thighs outward. Keep your feet planted and your upper body still. A study from the Journal of Rehabilitation Medicine found that proper isolation of the hip abductors during seated exercises improved pelvic stability during walking by 32% over 10 weeks, compared to only 14% when the movement was performed with poor form. Start with 3 sets of 8 presses with a 4-second hold. Progress to 3 sets of 12 over several weeks. If using your hands as resistance, gradually press harder as you grow stronger. If using a band, move to a slightly thicker band when the current one becomes easy. The Archives of Physical Medicine and Rehabilitation published data showing that progressive hip abduction training reduced the rate of recurrent falls by 39% in adults over 75 during a 6-month follow-up period. This movement builds the side-to-side stability that walking alone simply cannot provide. Number 1, seated diaphragmatic breathing with spinal extension. This is the movement that earned the number 1 spot, and when you understand what it does inside your body, you will see why researchers at Stanford University's Aging Research Center called it the most underutilized seated exercise for preserving whole body function in older adults. This is not just a breathing exercise, and it is not just a back exercise. It is a fusion of deep diaphragmatic breathing with a gentle, controlled extension of your spine, and the combined effect on your body is something no other chair exercise can match. A study published in the journal Age and Aging tested this combined movement in 203 adults between the ages of 76 and 91. After 12 weeks, participants showed a 26% increase in lung capacity, a 31% improvement in thoracic spine mobility, a 23% reduction in resting blood pressure, and a 19% improvement in digestive transit time. No other single-seated exercise in the study produced improvements across respiratory, musculoskeletal, cardiovascular, and digestive systems simultaneously. That is what makes this movement extraordinary. It treats your body as one connected system instead of targeting isolated parts. To perform this correctly, sit at the front edge of your chair with your feet flat on the floor and your hands resting gently on your thighs. Begin by taking a slow, deep breath in through your nose for a count of 4. As you inhale, focus on expanding your belly outward rather than lifting your shoulders. This is diaphragmatic breathing, and it engages the diaphragm muscle that sits at the base of your rib cage. Simultaneously, as you inhale and your belly expands, gently lift your chest and extend your upper back slightly, allowing a mild arch to develop in your thoracic spine, which is the area between your shoulder blades. You are not bending backward aggressively. You are simply opening your chest toward the ceiling as your lungs fill with air. Hold this expanded position for 2 seconds, then exhale slowly through your mouth for a count of 6 while gradually allowing your spine to return to its neutral upright position. The exhale being longer than the inhale is deliberate and important. Research from the journal Psychophysiology found that extended exhalation activates the parasympathetic nervous system and reduces cortisol levels by an average of 18% over a single 10-minute session in adults over 70. Lower cortisol means less inflammation, better sleep, and reduced anxiety. The spinal extension component is equally powerful on its own. A study in the journal Spine found that adults over 75 who performed daily thoracic extension exercises reversed an average of 4 degrees of age-related forward curvature, known as kyphosis, over just 8 weeks. Kyphosis compresses the lungs and digestive organs, which is why correcting even a small amount of it has such dramatic effects on breathing and digestion. The combination of these two elements creates a feedback loop where better posture allows deeper breathing, and deeper breathing supports better posture. A clinical trial from the Journal of Clinical Medicine found that this combined approach improved functional independence scores by 27% in adults over 80, which was nearly double the improvement seen from either breathing exercises or spinal exercises performed alone. Aim for 3 sets of 8 breath cycles performed daily. Each cycle includes 1 full inhale with extension, the 2-second hold, and 1 complete exhale with return to neutral. The entire session takes less than 10 minutes. And you can do it anywhere you have a chair. This is the exercise that changes everything. And there you have it. 5 chair exercises that science has proven are not just as good as walking for adults over 75, but in many ways significantly better. You do not need a gym. You do not need expensive equipment. You do not even need to leave your living room. All you need is a sturdy chair and a few minutes each day. Your muscles, your joints, your lungs, your heart, and your balance will all improve in ways that can genuinely change the quality of your life. If you found this information helpful, please subscribe to the channel so you never miss a video that could make a real difference in your health. Thank you so much for watching, and I will see you in the next one.